Welcome to the University of Minnesota Interventional Radiology Department. We are going to take you on a tour of the department. mHealth Fairview University of Minnesota Medical Center East Bank is the main site for IR training during the residency, but our residents also spend time at Hennepin Healthcare and at mHealth Fairview Clinic and Surgery Center, Minneapolis. The IR Physician Workroom is the main workspace where IR faculty, fellows, PAs, and NPs work during the day when they're not scrubbed in doing cases. Here, we review consults, patient charts, and imaging, do our own charting, and dictate procedure notes. Referring clinicians will sometimes visit us here to discuss in person about challenging patients and review their imaging and treatment options with us. The IR Nurses Station is the central command area for our department. Our IR charge nurse runs the day from here and organizes the flow of patients in and out of our procedure rooms. Our dedicated procedural CT room is where we perform CT-guided procedures. We perform most of our CT-guided biopsies, drain placements, and tumor ablation procedures in this room. Our ultrasound procedure rooms are used when we perform ultrasound-guided procedures, such as biopsies, paracentesis, thoracentesis, and ultrasound-guided drain placements. In this part of the department, we have 5 fluoroscopy and angiography suites where we perform more complex procedures, such as angioplasty, stenting, embolization, and thrombectomy procedures. We also perform bread-and-butter procedures, such as gastrostomy tube, nephrostomy tube, vertebroplasty, and central venous catheter and port placements here. We will now show you a couple of these rooms in detail. This room is a combined CT angiography suite where we can perform procedures using a combination of CT and angiography or use each modality alone. Combined procedures that we do here include TACE ablation, balloon occlusion ablation, and feeding tube and drainage catheter placement in patients with complex anatomy. The biplane angiography suite is where we can perform procedures looking in 2 planes at once. Neurointerventional procedures are also performed in this room. Room 2A is our day procedure area for our outpatients. It functions as a pre-procedural prep area and a post-procedural recovery area from where patients are discharged. OR24 is our hybrid angiography operating suite. We use it to perform interventional procedures that also require surgical assistance. For example, we perform all our aortic endograft placements, as well as mini laparotomy tips and mini laparotomy portal recanalization procedures here.